Ever wondered about the intricacies of American sexual health? It's a topic that's often brushed under the carpet, but its significance to our overall well-being cannot be overstated. American sexual health is a complex world, as diverse and varied as the country itself. It's an amalgamation of different perspectives, attitudes, and behaviors. It's influenced by a range of factors, from cultural norms to individual preferences, and it's continually evolving, adapting to new research findings and societal shifts. Sexual health is not just about the absence of disease or dysfunction. It's a state of physical, emotional, mental, and social well-being in relation to sexuality. It requires a positive and respectful approach to sexual relationships and sexual experiences, as well as the possibility of having pleasurable and safe sexual experiences, free from coercion, discrimination, and violence. Education plays a pivotal role in sexual health. Comprehensive sex education can provide individuals with the knowledge and skills they need to make informed decisions about their sexual behavior. It can help to foster healthy attitudes towards sex and sexuality, promote safe practices, and ultimately enhance sexual health. Yet, despite the importance of sexual health in education, the prevalence of sexually transmitted diseases or STDs in America is high. These infections, which are passed from one person to another through sexual contact, can have serious health consequences if not treated promptly. They underline the need for more education, more open dialogue, and more preventative measures. So, why are we talking about this? Because understanding and addressing sexual health is crucial to promoting overall health and well-being. It's about recognizing that our sexual health is an integral part of our overall health, and that by improving our sexual health, we can enhance our quality of life. Now that we've established the importance of sexual health, we can delve into more specific aspects. In the following scenes, we'll explore the importance of sex education, the prevalence of STDs in America, the role of regular checkups and vaccinations, and the path to better sexual health. So stick around, there's much to learn and discuss. Did you know that the level of sex education varies greatly across the United States? Indeed, the approach to sex education is as diverse as the country itself, with every state having its own guidelines and policies. In some states, comprehensive sex education is mandatory and includes not only abstinence but also information about contraceptives and safe sex practices. On the other hand, other states stress only abstinence, leaving youth without a complete understanding of their sexual health. Statistics reveal that states with comprehensive sex education have lower rates of teen pregnancies and sexually transmitted infections. This is because these programs equip young people with the knowledge they need to make informed decisions about their sexual health. They learn about contraception, sexually transmitted infections, and the importance of consent. However, in states where abstinence-only education is prevalent, the lack of comprehensive sexual education can lead to higher rates of unintended pregnancies and sexually transmitted diseases. This is because these programs often lack information about contraception and safe sex practices. The emphasis on abstinence may also stigmatize sexual activity, making it difficult for young people to seek advice or help when they need it. Moreover, comprehensive sex education can also help in developing healthier relationships. It can provide young people with the understanding that their sexual health is a vital part of their overall well-being. It teaches them about consent, respect, and communication in relationships, all essential for fostering healthy relationships. But it's not just about the youth. Adults, too, can benefit from sex education. Many adults lack basic knowledge about sexual health, which can lead to risky behaviors. Therefore, comprehensive sex education should be a lifelong learning process. The disparities in sex education across the country are concerning. They highlight the urgent need for a more standardized, comprehensive approach to sex education. After all, knowledge is power, and in this case, it can lead to healthier sexual behaviors and outcomes. As we can see, education plays a crucial role in shaping sexual health outcomes. It's time we recognize the importance of comprehensive sex education and work towards ensuring it's accessible to all, regardless of where they live. Sexually transmitted diseases are a significant issue in American sexual health, but just how prevalent are they? According to the Centers for Disease Control and Prevention, there are approximately 20 million new sexually transmitted infections in the United States each year. That's nearly 55,000 new cases every single day. Over half of these infections occur among young people aged 15 to 24. Let's take a closer look at some specific diseases. Chlamydia, for example, is the most commonly reported STD in the United States. In 2022, there were over 1.5 million reported cases of chlamydia. This is a significant increase from 10 years prior, indicating a growing trend. Gonorrhea, another common STD, has also seen a steady rise, with over 500,000 cases reported in 2022. Alarmingly, this disease is becoming increasingly resistant to antibiotics, making it a significant concern for public health. Now let's talk about geographic variations. STD rates can vary considerably across different regions. For instance, the southern states tend to report higher rates of STDs compared to other regions. This could be due to a variety of factors, including accessibility to healthcare and education. Age and sex also play a role in the prevalence of STDs. As mentioned earlier, young people are disproportionately affected. Additionally, women are often more vulnerable to certain STDs due to biological factors. It's also worth noting that certain populations, such as men who have sex with men and racial and ethnic minorities, are disproportionately affected by STDs. This highlights the need for tailored prevention and treatment efforts for these groups. In conclusion, STDs are a widespread and growing problem in the United States, affecting millions of people each year. The prevalence varies by age, sex, geographic location, and certain population groups. Understanding these trends and variations is critical to developing effective strategies for prevention and treatment. Understanding the prevalence of STDs is an important step in promoting sexual health. Regular checkups and vaccinations are essential tools in maintaining sexual health. But how often are Americans utilizing these resources? In the realm of sexual health, preventative measures like regular checkups and vaccinations play a crucial role. They act as the first line of defense, helping to identify potential problems before they escalate and ensuring that we are protected against diseases that can be prevented. Yet, despite their importance, not everyone is taking full advantage of these resources. Recent statistics indicate that a significant number of Americans do not get regular checkups. A myriad of reasons contribute to this, from lack of access to healthcare services to fear of stigma or discrimination. However, it's important to remember that these checkups are not just about finding problems. They're about maintaining overall health and well-being. Regular checkups can detect early signs of various sexually transmitted infections, which can be more effectively managed when caught early. Vaccinations, on the other hand, are a potent preventive tool. They fortify our immune system against certain diseases, including those that can be sexually transmitted, like human papillomavirus or HPV. Despite the availability of the HPV vaccine, which has been proven to significantly reduce the risk of several types of cancer, the uptake among eligible Americans is still not as high as it could be. The reasons behind this are complex. Vaccine hesitancy, fueled by misinformation, is one factor. Others simply may not be aware of the vaccines available or their benefits. This highlights the need for more effective education and communication about the role of vaccinations in sexual health. Remember, sexual health is a fundamental aspect of our overall health, and regular checkups and vaccinations are important tools in maintaining it. They provide an opportunity for education, prevention, and early detection, ultimately leading to better health outcomes. So let's strive to break down barriers, dispel myths, and encourage more open discussions about sexual health. After all, taking care of our sexual health is a responsibility we all share. Regular checkups and vaccinations are key in protecting oneself from sexual health risks. So, what can Americans do to improve their sexual health? Let's dive into a few practical steps that can make a significant difference in your overall sexual well-being. First off, seeking regular medical care is essential. Regular health checkups can help detect any potential issues early on, making them easier to treat. Don't hesitate to discuss your sexual health with your healthcare provider. They're there to help, not to judge. Next, consider getting vaccinated. Vaccines can protect against certain sexually transmitted infections such as human papillomavirus or HPV and hepatitis B. If you're sexually active, it's wise to discuss these vaccinations with your healthcare provider. The third tip is practicing safe sex. This means using protection every time you engage in sexual activity. Condoms, for instance, not only prevent unwanted pregnancies, but also reduce the risk of contracting sexually transmitted diseases. Remember, the dialogue about consent is also a part of safe sex. It's crucial to respect your partner's boundaries and to ensure that any sexual activity is consensual. Fourthly, educate yourself. Stay informed about sexual health issues. The more you know, the better you can protect yourself and your partner. There are numerous resources available online, from reputable health websites to online forums. Lastly, maintaining a healthy lifestyle can also contribute to better sexual health. This includes regular exercise, a balanced diet, adequate sleep, and reducing stress levels. All these factors play a significant role in your overall health, including your sexual well-being. So, to recap, the path to better sexual health involves regular medical care, vaccinations, safe sex practices, staying informed, and maintaining a healthy lifestyle. It might seem like a lot, but every small step you take towards better health is a step in the right direction. By taking these steps, Americans can make strides towards better sexual health. And remember, it's never too late to start making healthier choices. You have the power to shape your sexual health. Take control, take action, and make your sexual health a priority.